It's always important to remind ourselves that most of the bacteria and the viruses and the other microbes that we get exposed to every day actually don't cause disease. Most bacteria and viruses are either completely harmless or are actually beneficial to us, part of our natural microbiome, in other words. That means that we have to always be investigating the types of relationships that the human body has with its microbial inhabitants. And that brings us to this term symbiosis or biological association. That's all a symbiosis is. It's a relationship between two different organisms, or I should say, two or more organisms. And symbiosis is a concept that we can investigate a little bit further and define terms like mutualism and commensalism and parasitism, which helps again with the understanding of how certain microbes interact with humans to cause diseases. So when we use the term symbiosis, it's almost like a larger umbrella over these other terms. Mutualism, for example, describes a symbiotic relationship where both of the organisms that are in that relationship benefit from that relationship. In other words, the two organisms are better off together than they would be apart. And an example of this in the human body would be E. coli living in our intestinal tract. Remember, there are different species and different strains of bacteria. There are strains of E. coli that are pathogenic, but a lot of the strains of E. coli that you can find in a human are not only harmless, but actually beneficial to us. The E. coli also benefits from having the environment to live in of the human intestine. That's mutualism. Commensalism is a little bit different. In commensalism, there's a symbiotic relationship where one of the organisms benefits and the other organism is just unaffected by it, neither harmed nor benefited. A lot of the flora that lives in the human body falls into this category of symbiosis, this category of biological relationships. The human being often benefits by having the microbe. The microbe doesn't necessarily gain any benefit from that relationship. And that brings us to parasitism. Parasitism is also a symbiotic relationship. It's a biological association between two or more organisms. But in parasitism, while one of the organisms is going to benefit, the other organism or organisms are not going to benefit. They are actually going to be harmed by the relationship. So when we think about pathogenic bacteria and pathogenic viruses and fungi and things like that, there are a fair number of them that would fall into this category of symbiosis, this parasitism category. They're getting the benefit of living inside our body and growing and getting access to nutrients and so on. And we are being harmed by their presence. So we're going to define this term pathogen as a microbe that causes infection and disease in a host organism. There are two other terms that you'll hear me use when we talk about transmission of infectious disease, and those need definitions as well. The first is this term virulence. Virulence is a term that describes the degree of harm that a pathogen is capable of doing to a host. In other words, virulence is a measure of pathogenicity. All pathogens all pathogens are capable of causing disease, but individual pathogens can be more virulent or less virulent. Again, it's sort of a scale of pathogenicity. A virulence factor is actually a particular molecule that's produced by a pathogen that helps in terms of its virulence. So a virulence factor is a thing, a molecule, a trait that a microbe has that contributes to its virulence. Some other definitions that we should be comfortable with include this definition of the word disease. A disease is simply a disorder of the structure or the function of the body. So it's a term that has a very wide-ranging definition. Infections of the body are, of course, a form of disease. Two other terms that we need to define that are commonly exchanged incorrectly for each other are this term exposure and infection. When we use this word exposure, what we're saying is that a host organism has come into contact with a pathogenic microbe. But infection implies both the penetration of that microbe into the body and the growth of that microbe, or the multiplication of that microbe within the host organism. From germ theory, if you recall, Pasteur and others believed that it was actually the entry or the penetration of the microbe into the body, and again, its multiplication, its growth, that caused disease. So we have to distinguish when we talk about pathogens and infectious disease, we have to distinguish between whether or not an individual has been exposed to that pathogen and whether or not they've been infected with that pathogen. So let's think for a minute about this phenomenon of infection. When the pathogenic microbe penetrates the body, gets into the body, and then begins to multiply. The terms that we use to describe the stages of infection are listed on the slide. There's acute, subacute, chronic, and then subclinical. An acute infection is described as having a rapid onset, a relatively brief period of illness with symptoms, and then a relatively rapid resolution, typically days to weeks. So we could describe the COVID-19 disease as being an acute infection. In subacute infections, the disease is still relatively rapid in its course, but the symptomology is less severe. So the person still has signs of the disease, but those signs and symptoms are just less severe than they would be in an acute infection. Chronic infection gets its name primarily because of the slow course of the disease. So in a chronic infection, the symptoms may or may not be severe, but they persist over a relatively long period of time. And we usually define chronic infection as lasting greater than 6 months, although some sources will describe chronic infection as being any time longer than 3 to 6 months. And finally, there's this term subclinical, and it's easy to get subclinical and subacute confused with each other, but they mean two different things. A subclinical infection is the case where the infection is present, but the person who has the infection shows no outward signs of having it. So we often refer to people who have a subclinical infection as being carriers of the infectious disease. They have it, it has penetrated the body, and the microbe is indeed replicating in the body. So carriers are able to spread the infection, but they don't realize that they have the infection because they don't have any symptoms. So we can describe different types of infection using terms like acute and subacute and chronic and so on. But we can also describe the stages of an individual infection, and that's what we're looking at on this slide. What you can see on this graph on the x-axis is simply time going by. It starts over here on the left with the exposure, when the person originally gets exposed to the pathogenic microbe. And then we have this curve which rises up to a peak and then back down again over time. And each phase of this or stage of infection is shown as we pass over the curve. So if we start over on the left-hand side, after exposure, the first stage of infection is what we call the incubation period. Now, the incubation period for most infectious microbes is somewhere between about 2 days and 14 days. Now, for many infectious diseases, we can narrow that range down and be a little more precise, but there are some microbes that people respond to very differently. And so in one person, the incubation might be only 2 days, and in another person, it might be as long as 14 days. So it really does vary depending on the microbe. During the incubation period, the person who has become infected has no symptoms. The next stage of infection is called the prodromal period. And during the prodromal period, the person has a very vague sense that they're getting ill. And you've probably experienced this more than once in your lifetime. You know that feeling when you get up one day and you're just not quite right. Maybe you have a low-level headache, or maybe you have some aches and pains. Maybe you're just feeling a little overtired. It's the kind of non-specific symptom that you wouldn't necessarily attribute to an infection right away, but you know that you're just not well in that moment. After the prodromal period, we go into what's called the invasive phase. And this would be what we would think of as a full-blown or a very active period of infection. During the invasive phase, the symptoms become much more pronounced. It becomes more obvious to the person exactly what kind of infection they have. Those vague feelings of being unwell give way to much more specific symptoms. And then from there, we move on into what's referred to as the acme or the peak of the infection. This is the time that the person feels the sickest. And then we start down the other side of the curve. We move into what's called the decline phase. This is the time when the symptoms start to let up a little bit. The person begins to have a feeling that they're getting better, that they're recovering. They're still showing symptoms, but the severity of those symptoms is starting to give way. That leads into what's called the convalescent period. This is the time where the person's symptoms have often gone away, but they're still not 100% back to how they would feel normally. This is typically when the infection ends for most people, but you'll notice that there is one other stage at the end of the curve, and that stage gets the name sequela. If you're unfamiliar with this term, a sequela describes a symptom that can sometimes persist in a person after the infection has resolved. So there are some people who develop long-lasting symptoms or conditions as a result of an infection, something that doesn't go away even after the infection has resolved. If you ever speak to people who've had Lyme disease, for example, There are a subset of those patients who will tell you that they developed some non-specific joint pain and things like that, muscle pain, after recovering from their Lyme disease infection. That's a sequela. That's a symptom or a condition that lasts after the infection itself has gone away.